Hello, my name is Dr. Dewan S. Raja. Today I will discuss about the anatomy of the cavernous sinus. The cavernous sinuses are paired dural venous sinuses. They are present by the side of the body of the sphenoid bone. The sinus extends from the superior orbital fissure anteriorly to the apex of the petrous temporal bone posteriorly. Average length is 2 centimeter and the width is 1 centimeter. So it is a venous sinus. It is inside the dura mater. We know that dura mater has two layers, endosteal layer, meningeal layer, and its name is cavernous. That means it has a lot of spaces, cavernous spaces. Here, here we have lot. We are seeing lot of spaces, and these spaces are done by the trabeculae, and the blood from will get also blood vessel, the large blood vessel, internal carotid artery, and nerves. They are separated from the venous blood by the endothelium. So if you look at the relationship of the cavernous sinus, you'll find out that below we're looking at the sphenoidal paranasal sinuses here. Medial to it is the pituitary gland here. Above we're looking here that this is the optic chiasm here. This is the optic chiasm. Laterally, it contains the temporal lobe and the uncus of the temporal lobe. Okay. So what are the tributaries of the cavernous sinus? As because it is a venous space, it should have tributaries. We have the superior ophthalmic vein. This is the superior ophthalmic vein. We have inferior ophthalmic vein, superior middle cerebral vein. Okay. So inferior cerebral vein, sphenopalatine sinus. This is the sphenopalatine sinus here. This is one. Another one is here. Okay. Then central retinal vein that may open into the cavernous sinus or it may open into the superior ophthalmic vein. Okay. Frontal tributaries of the middle meningeal vein, again it may or may not directly connected to the cavernous sinus, but these are always the tributaries of the cavernous sinus. Superior ophthalmic vein, inferior ophthalmic vein, superficial middle cerebral vein, inferior cerebral vein, and the sphenopalatine sinus. We got that. Okay. Okay. So what is the drainage or communication of the cavernous sinus? The cavernous sinus drains into the transverse sinus. This is the transverse sinus. That is also, those are also paired dural venous sinuses. We have the superior petrosal sinus. This is done by this connection by the superior petrosal sinus here. The sinus is also communicated to the facial vein and pterygoid plexus of vein. The connections are valveless and the direction of flow in them is reversible. It is both way communication because there is no valve. We have intercavernous sinuses that connect one cavernous sinus to the cavernous sinus on the other side. Okay, so there is communication between two cavernous sinuses. Okay, structure in the cavernous sinus. What are the structure that is present in the cavernous sinus? The following structure passes through the cavernous sinus: the internal carotid artery. Yeah, its location maybe here, maybe a bit up, because the passage is not straight passage, rather it is curved passage. So depending on the site of section, in some of the image you'll see this is the lower part, in other image you'll see the internal carotid artery is in the middle. Okay, that is usual. It depends on the section location of the internal carotid artery. Internal carotid artery is accompanied by plexus of sympathetic nerve and veins. Also, close to the internal carotid artery, we have the abducent nerve, the sixth cranial nerve. That is very important nerve for the lateral rectus muscle. There is an extraocular muscle. Okay, so internal carotid artery and abducent nerve going through the substance of the cavernous sinus. Following structures passes through the lateral wall. What are those structures? These are the third, fourth, and the ophthalmic division of trigeminal nerve, the maxillary division of trigeminal nerve. Third nerve is the oculomotor nerve. There is the third cranial nerve. Fourth nerve is the trochlear nerve. Third nerve innervates a lot of extraocular muscle, also intraocular muscles. The fourth nerve, trochlear nerve, supplies the superior oblique muscle, that is an extraocular muscle. Okay, so we got oculomotor nerve, trochlear nerve, ophthalmic division of trigeminal nerve, maxillary division of trigeminal nerve. Okay, okay. So we got the communication, we got the content. Now we'll find out some of the clinical or medical application. In certain situations, there may be Carotico-cavernous Sinus Fistula, or in certain other situations, we may have spread of infection that lead to cavernous sinus thrombosis. First of all, let's go to the Carotico-venous Sinus Fistula. What happened? This is the internal carotid artery. It's blood, arterial blood with high pressure, and these are the venous blood in the cavernous spaces. Okay, they are separated by the endothelial cell. Sometimes it may be ruptured due to trauma, due to some type of aneurysm, may also cause compression to the cranial nerves, so maybe traumatic, maybe due to just aneurysm, that is the abnormal dilatation of the blood vessel, that is possible, or it may be infected or degenerated, so this blood may mix with that of the blood of the venous spaces. Okay, that will reflux to the ophthalmic vein, and the eyeball will be pulsatile in in synchronous with that of the radial pulse, and we'll get the pulsating edge of thalamus. Eyeball is protruded forward with pulsation because the pulsation is reflection of pulsation of the internal carotid artery. So in case of when this happened, as we discussed, head trauma, head injury, degenerative or aneurysmal vessel disease, the aneurysm may be ruptured, or aneurysm may just compress the nerve. Aneurysm is the abnormal dilatation of the blood vessel, causes pulsatile exophthalmos, periorbital edema, chemosis. Color will be changed, okay, because of stagnation of blood cell and their hemolysis. Ophthalmoplegia, both extraocular muscle and also intraocular muscle will be involved and may lead to complete blindness. And paresthesia, because the maxillary division of the trigeminal nerve and the ophthalmic division of trigeminal nerve are sensory component of the trigeminal nerve. So if this nerve are compressed by the aneurysm or excessive blood here due to rupture of the internal carotid artery, it may compress these nerves, and there will be paresthesia. On the other hand, infection from the nose, face, paranasal sinuses, or we can call from the mask area. Okay, what will happen? Infection may reach the cavernous sinus, also from other sites by direct communication or via the emissary vein. Emissary veins are veins which connects the extracranial vein to the intracranial veins. So due to this communication, there may be spread of infection in the cavernous space. There may be thrombosis. Okay, that may have very much devastating outcome. Okay, these are the viva question. I'll request everyone to solve the Viva question from any textbook of neuroanatomy. Also, you can follow my YouTube video, what I have described here. So you must know everything from here. And these are my references. Please ask me any question. Please share the information with your friends. And please support my channel. Please subscribe me. And have a nice day. Bye now.